Welcome to Healthcare Today. Thank you for joining us. Last time we looked at prostate cancer as one of the commonest cancer situations in men, but today we're looking at breast cancer, which is the commonest cancer in women globally. Both in Nigeria and across the world, you'll find breast cancer as the commonest cause of cancer-related deaths. The statistics we have as of 2020 showed that over 28,000 new cases of breast cancer was diagnosed. And that's a very high number, really high. And up to 18.1% of all cancer-related deaths in Nigeria was attributed to breast cancer. So that makes it, a very major cause of death in Nigeria. Indeed, globally, Nigeria has the highest prevalence cases of breast cancer related deaths in the world, one of the highest. How do we identify this disease? What are the symptoms that an individual may present with? I think that is very key. So don't ignore, the following things I'm going to mention. If you suddenly noticed a lump in your breast, obviously that is abnormal. Don't ignore it. Don't ignore any form of growth in the armpit, whether painful or painless. If you notice any swelling in your armpit, whether it's painful or painless, it's important to seek medical attention. Don't ignore it when you suddenly notice that your nipple is, inverting inwards instead of projecting outwards. It's kind of inverting inwards, or having a kind of sore, or producing discharge that is bloody in nature. Any form of discharge, especially if it's bloody in nature, painful around the nipple, you might want to check with your doctor. Of course, we also know that breast pain generally, due to hormonal changes, is one of the commonest causes of pain in the breast, hormonal changes, and this is one of the major reasons why a woman may visit her doctor, breast pain. But then, when this breast pain, becomes unusually persistent, coupled with discharge from the nipple, this discharge may be bloody. You may want to check with your doctor. If you begin to see dimples on your skin of the breast, as if the breast is looking like the skin of an orange, you may want to also check with your doctor, because that could be a sign of cancer of the breast. Sometimes there might be no symptom even at the level of the breast, and suddenly somebody begins to present with pain, maybe back pain, low abdominal pain, pain in the chest, because some cases of breast cancer may spread to other tissues even before the diagnosis is made at the level of the breast, even before it presents with any changes in the breast. It may spread to other tissues. A few cases like that, has been picked up in the past. Can spread to the bone, can spread to the lungs, can spread to the organs in the abdomen, and therefore unusual pain, unusual symptoms may emanate from those other organs. Bottom line is, if you have symptoms that are unexplainable to you, consult with your doctor for proper examination. Breast cancer runs in families, and therefore there is a tendency that certain genetic disposition can make a woman, have breast cancer because, it runs in their family, it runs in their lineage. So it's important, therefore, that if a family member has had breast cancer in the past, that every, woman in that family should be cautious and conduct periodic medical examination. Before now, we tell women to do, mammogram and stuff like that from age 40 and above. But we see breast cancer happening these days even before the age of 30. We've picked up a few cases like that. Breast cancer between the ages of 30 and 40, just before 30 years of age, and you're wondering how this is happening. Now, the causes, beyond the fact that cancer of the breast can run in family, other causes are practically unknown, and so we don't have preventive advice to give in terms of don't eat this or don't eat that. But generally, if you have a family history of breast cancer or other cancers for that matter, then it's important to be cautious. Do mammogram every 2 years at the least. I think because of irradiation, we tend to limit it to 2 yearly. But even if within the interval, if you notice any symptom that is unusual, consult with your doctor. If you notice any bloody discharge from the nipple, consult with your doctor so that they can, the doctor can run proper examinations. These days, you could do as much as genetic studies to check your own predisposition to breast cancer as an individual. It is important, to take this very seriously because it's a major cause of death. The breast cancer itself does not kill. It is the complications of breast cancer when it spreads to other organs and other, locations that leads to fatality. And that's why we advocate for early, diagnosis so that treatment can be offered, as quickly as possible. Usually, if this disease is diagnosed when it is at maybe grade 1 or 2, you can have complete remission with proper care. Grade 3, grade 4, things are already getting out of hand. The 5-year survival rate becomes very low at that point. And so this is a call for action, a call for caution in women, especially 40 years and above. But I have also said that breast cancer is occurring these days much earlier than 40. Therefore, any unusual symptom that a young woman notices, that symptom should be thoroughly investigated so that you don't leave things to chances. Now, when this disease occurs, it's important that action is taken promptly. Do not attribute it to some witchcraft or some, enemy somewhere, afflicting you. Please, if you notice any unusual symptom in your breast, swelling, pain, change in the skin color, nipple being retracted, discharge that is unusual, swelling in your armpit, painful or painless, and such symptoms like that, consult with your doctor. Breast cancer is real, is the highest killer among the cancers in women, both in Nigeria and globally, like I said earlier, and it cannot be ignored. Now, when it comes to the treatment of breast cancer, the treatment option oftentimes depends on one, how quickly the was picked up, and two, the choices of your doctor, and then of course three, the diagnosis has been made in terms of immunochemistry, that the type of cancer you're dealing with in the first place, because there are different types of breast cancer in the first place. So treatment pathway may vary, options may vary, but it commonly, between chemotherapy, that is anti-cancer medications. The doctor oftentimes might also opt for surgery if there is a mass, to remove the mass or even remove the breast, as the case may be. So sometimes the doctor may do a conservative surgery where part of the breast is preserved and the breast can be reconstructed afterwards. But other times, total removal of the breast and Subsequently, people also then have what we call radiotherapy, which is used to burn out every other tissue that may spring up eventually, every cancer tissue that may spring up eventually, even after surgery. So these are the three common pathways to treating breast cancer: either the use of anti-cancer medications, surgical intervention, radiotherapy. The aftercare that then follows, there must be monitoring of the patient to ensure that the cancer has not resurfaced in that particular breast that has been attended to, and also to be sure that the other breast has not developed something, because the fact that a woman has had cancer on one breast does not mean that that same person cannot have cancer in the other breast. So it's important anyway. This program is not about discussing treatment. Your doctor will always walk you through the best treatment for you. So take care and remain healthy.